Hello and welcome to this special program. When it comes to heart disease in India, statistics speak volumes. In the last 2 decades, heart disease has been the leading cause of death in the country, with a quarter of all deaths being caused by various cardiovascular diseases. Even worse is the fact that disease hits us Indians in our most productive middle years. In fact, almost every family has at least one member with heart disease. Improved awareness may lead to early recognition of CVD symptoms and their risk factors, and make patients aware of the importance of regular checks, even if a person is ostensibly healthy. Also, most cardiac deaths are sudden and happen on the spot. It's possible to prevent many of these sudden deaths if immediate medical attention and CPR is given. Many adults in cardiac arrest can be revived with neurological functions intact if bystanders can provide immediate and correct CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of interventions in cardiac arrest cases. It's time we take our heart health into our own hands and try and be healthier and safer. Today we have with us cardiologists who help you understand what sudden cardiac death is and the role of CPR to revive and save a life. We're being joined by Dr. Ashok Kumar, Assistant Professor, PMCH Patna. He's a consultant interventional cardiologist with IGIC Paras HMRI, Rudalaya Heart and Blood Vessels Care Clinic, Patna. We're also joined by Shupatip Kundu, Consultant Interventional Cardiologist at the AMRI Hospital, Dhakuria, Kolkata, and Dr. Soothelai Valal, Founder and Senior Consultant Interventional Cardiologist with the Venkateshwara Hospitals in Chennai. Thank you all, gentlemen, for being with us today. Dr. Kumar, if I can begin with you. Cardiovascular diseases are a group of disorders that seem to affect the heart and blood vessels, but which cardiovascular disease is actually the deadliest and why?
Earlier, you have rightly said that 1/4, but not. I am not convinced with that. The data says that 1/3, more than 30% of death is related to cardiovascular diseases, and it mainly occurs due to choking in the arteries. When the blockage occurs in coronary artery, it leads to myocardial infarction, and that is the deadliest thing what we face in our clinical practice. And that is the #1 killer among all cardiovascular diseases. So myocardial infarction is the most deadliest thing, and if the patient or victims get treatment on time, we can save a life.
Right. Dr. Thilaivalal, is it true that Indians are more prone to heart disease? And if that is indeed the case, is there any reason behind this?
Yes, it is 4 times higher than Europeans and Americans, and 10 times higher than Chinese, and 20 times higher than Japanese. That too, it affects 10 to 15 years younger than other nationals. The important reasons are 4. Number 1 is a change in lifestyle. Our diet pattern has changed. By diet, lifestyle means diet, exercise, and sleep and stress. In diet, the increase of salt intake and increase of sugar intake and increase of oil refined item with saturated fat and trans fatty acid intake is added to the fact. And second is exercise. Lack of adequate exercise is another factor. Then adequate sleep is also very important. 7 to 8 hours of sleep, all are lacking. And stress levels are higher in Indians, that's another factor. The other three other factors are we are genetically prone because of the change in economic status, and our blood levels of LPA and ApoB are higher than other nationals. The new added factors are pollution and radiation. The radiofrequency radiation as pollution. Last year, our World Health Foundation has found out that 25% heart attacks are due to the pollution. So India has 63 cities out of 100 most polluted cities in the world. So there is also added factors. The above all, lack of awareness and active intervention of the prevention is needed actually. By that we can reduce and avoid it.
Right. If I can also take this across now to Dr. Kundu. Dr. Kundu, what about the long-term use of painkillers? Can these increase the risk of a heart attack or a stroke?
Surely. Long-term painkillers increases the risk of heart attack, especially in heart attack survivors. That is according to a Danish study, and that is quite a large population. So, and it also increases the risk of ischemic stroke in high cardiovascular risk patients.
Right.
Apart from this, it also increases the hypertension, and it also increases the risk of heart failure symptom exacerbations in heart failure patients. But there are certain types of painkiller which are safe to consume, number one, but without prescription, don't use any unprescribed medicine because that may cause harm to your heart.
All right, fair enough. Dr. Kumar, are there any symptoms of heart disease that people should be aware of so that they can get early treatment for the same?
Yeah, there are lots of sign and symptom for heart diseases. So it mainly depends upon the which cardiac problem is predominantly inside the patient is there. So most common is angina on effort, that is known as chest heaviness whenever the patient exert for something, and it get relief on rest or taking sublingual nitrate. So these are the classical thing, but classical thing doesn't occur always. So some non-specific sign and symptom is there. If patient is feeling uneasy, easy fatigability, so that means once he was able to do much exercise, but on even on the lighter exercise, he or she is feeling fatigue or become dyspneic or breathlessness on mild exertion, even pedal edema, that is swelling in the lower limb. Even the patients develop palpitation, undue palpitation on walking or going upstairs. So, and even some feeling giddiness or a brief episode of blackout. So, these are the sign and symptoms for heart disease. So, whenever any patients develop these symptoms, must contact to your local doctor. And most important thing is most of the time, heart attack is being confused with indigestion sort of thing. So many times the patients feel uneasiness in abdomen, bloating, or even pain in epigastric region. They go to contact, they doesn't even contact to the doctors, and they used to take some local things. So these are not good thing. And those patients who are having comorbidities like hypertension, diabetic, elderly patients, so they must take care of him or herself. And even these symptoms occur, they must contact to local physicians. Thank you.
Right. Dr. Thilaivalal, why do some people get cardiac arrests while they're sleeping? Are there any symptoms which can help them to identify that risk?
It is a very important question. Among all the sudden cardiac death, precisely 62 to 65% happens at night. You may be aware there are 30% of heart attacks are silent. That's another factor. If you take the reason for sudden death at night, as I told you, 62% happens at night. In that, common diseases are heart attacks. That is 80 to 90% heart attack, and 10% may be stroke, and another 10% can be irregular heartbeat. This happens due to the left main coronary artery disease. Among all the blocks in the heart blood vessels, 10% patients have block in the main vessel, left main coronary artery. When that left main coronary artery block ruptures and heart attack happens, sudden death happens. So amounts to about 3 to 4% people can die like that suddenly at night. So second is severe LV dysfunction due to damage done already. So the heart pumping power is already compromised. They can die suddenly at night. The another factor is irregular heartbeat, commonly called ventricular fibrillation. Ventricular fibrillation is a precursor for cardiac arrest. That causes asystole, and that leads to cardiac arrest at night commonly. And how we can avoid is an important question. Though heart attack is the most predictable and most preventable disease, it is also most treatable disease if diagnosed early. For example, do not ignore any symptom. For example, some heaviness, some unusual back pain, or unaccustomed left arm pain, or unusual sweating, unaccustomed exhaustion, some type of tiredness or giddiness, or jaw pain, even rarely stomach pain. Any symptom do not ignore while you are walking. Only if you walk, the symptom can be brought to the surface. So you have to walk daily, minimum 30 minutes a day. and preferably 45 minutes to 60 minutes a day. So when walking, if you have symptom, you are detecting the problem early, so then we can assess and identify the background diseases, and we can go for primary prevention. The other next point is you have to meet a good doctor who is knowledgeable and passionate, so that he can correctly diagnose and guide you and help you. To diagnose heart disease, we recommend people from the age of 40 years every year. Now we have reduced the age to 30 years onwards. Every year we have to check from the age of 30 years. If you have family history, start checking BP, sugar, cholesterol and all from the age of 20 years onwards. If you have a strong family history, if they are normal, then check once in 3 years until the age of 40. Then subsequently every year you have to check. Because blood pressure 2/3 are silent, diabetes again 75% are silent, cholesterol 95% are silent. Unless you check with the annual checkup, many silent diseases are missed. So please have an annual evaluation regularly. And also you have to focus on sleep. Obstructive sleep disorders can lead to sudden death at night. One of them is obstructive sleep apnea. Commonly, this obstruction to the breathing occurs at night. That leads to low oxygen and irregular heartbeat or cardiac arrest. So we have to sleep disorders also can cause sudden death. So we have to focus on multiple risk factors so that a good doctor can predict and prevent it.
Right. Thank you so much for that very comprehensive answer there. We will take a quick break at this point, but coming up after that, what are the emergency actions to help someone experiencing a heart attack? What exactly does CPR consist of? We'll talk about all of that. We'll be back in just a moment. We're looking at ways to increase awareness of cardiovascular diseases and possible interventions. We have with us, as always, eminent cardiologists to do that. Let's go right back to Dr. Kundu at this point. Dr. Kundu, what are some emergency actions that a bystander or a close relative can take to help someone who's experiencing a heart attack in front of them?
Okay. That is one very important question, because everyone should know that what action they should take when experience some symptoms of heart attack. First of all, they should take some medicines like sublingual sorbitrate, which will reduce the chest pain. Number one. Number two, immediately should call the ambulance and they should reach the nearby hospital. Number three, they should get one ECG done to detect whether it is heart attack or not. Number four, and last but not the least, this is that they should not ignore any symptom and they should not consume any medicine in the home, and they should not ignore the symptom as symptoms of hyperacidity. So these are the actions they should follow. And we want to remind one thing: heart attack is easily treatable thing if you reach the emergency on time. That is very important thing. Everyone should remember that if you reach the emergency on time, then you will be completely relieved and you will be completely cured. And time is muscle. That is one of the most important message we need to deliver.
Right. Time is muscle. Now, words to live by. Dr. Kumar, cardiac arrest and heart attack are seen now quite commonly in young people as well. Can CPR actually help to reduce fatality rate? And, what exactly is cardiopulmonary resuscitation?
Yeah, definitely. This is a very pertinent question of the current time. First of all, we should know what is the difference between heart attack and cardiac arrest. Cardiac arrest occurs when your heart stops pumping. It might be due to asystole or sudden fatal arrhythmias like ventricular tachycardia. And heart attack is, in common term, it is a common name of myocardial infarction. So how to tackle with myocardial infarction? Dr. Kundu has already explained very well. So I will concentrate more on cardiac arrest. What happens when your heart stops pumping? The supply of brain is cut off and patients become unconscious. So whenever you see a patient suddenly he fell down or become unconscious, so even a bystander can do CPR. And CPR, main thing of CPR is to increase the circulation and revive the patient. So how to do this is most important thing. This is called cardiopulmonary resuscitation. And whenever you see a patient become unconscious, suddenly fell down, just go tap him and ask, "Are you okay?" If there is no answer from them, then just see he is breathing or not. Just by putting your finger beneath the nose, you can judge the breathing is occurring or not. Then turn the face to one side and just start compressing the chest. Just make like this, and your this part should be on a sternum. That is the lowermost part of your chest. Just go down and here just press your hand and start compressing. And compression should be 4 to 5 centimeter in depth, and it should be rapid enough to do 100 compression at least in 1 minute. If there is 2 person is there, you can give mouth to mouth breathing on 30:2 ratio. That means 30 times compression and 2 times respiration. And even after each 2 minutes, you have to ask the patient or see he or she has gained consciousness or not. Many a time in ventricular tachycardia, what happens, even by doing thumb version, ventricular tachycardia subsides and patients become in sinus rhythm, and he or she may regain consciousness. So by doing these simple things, we can save many lives. Even more than 50% of cardiac arrest patients can be revived by this method. And after whenever the patients revive, just arrange to shift the patient to nearby hospital. That's the thing.
Right. All right. Dr. Thilaiwala, when should someone stop carrying out CPR on a person?
Dr. Ashok Kumar told when you are lucky, 50% people can be revived correctly in a heart attack by correct CPR. If the patient recovers, we are lucky, we have to stop it. How we find out? If patients show signs of life like heartbeat, pulse is felt, and breathing has become normal and is able to communicate to you or regains consciousness, then we have to stop CPR. And how long to continue? Suppose you continue for 30 minutes minimum, usually we follow at least 40 minutes. There's no response, there's a flat line, no heartbeat, no signs of electrical activity, then we have to stop it. But rarely, intermittently, the heartbeat comes in the monitor in the ICU, then we continue. Through that, we have continued the CPR for more than 1.5 hours also. We have revived some patients. There's no possible. So general dictum is minimum 30 minutes, commonly 40 minutes we try and then declare. Temporarily, we have to stop CPR while we give DC shock. CPR is chest compression that we have to stop when you give a defibrillator, using defibrillator, giving electric shock. At that time, you have to stop CPR, give the shock again, continue the CPR. And the fourth important thing, when you are tired, call for help. When the help comes, you stop the CPR because your effectiveness has come down. So your bystander, your friend will take over, your colleague will take over, then you have to stop it.
Right. That's very clear. Dr. Kundu, one last question. If a person survives a sudden cardiac arrest, then are there treatment options available to them, and what are these treatment options?
Okay. First of all, we should remember that this CPR is a temporary measure, but very important measure to keep the person alive until the next advanced measures come. So first thing is to take the patient to ICU. Then next step is to determine the cause of this sudden cardiac arrest. That is very important. In some case, it may be coronary artery disease. So we have to go for angioplasty and all those things. In some cases, it may be some DCM, ventricular tachycardias, and all types of arrhythmias. So we can put pacemaker-like device, which is known as AICD, in these patients, which increases the chance of survival and prevents the sudden cardiac death in these patients. And the last of all, everyone should not forget those medicines prescribed by doctor after returning to normal life, because those medicines are very important to keep the heart rhythm steady or to keep the blood flow in heart normal. So basically, treat the cause and take long-term medicines which are prescribed by the doctors. This is important.
Right. Let me also take this across to Dr. Kumar. What is the role of cardiac rehabilitation for patients who've suffered cardiac arrest?
Yeah, this is the most important question for nowadays, because we have moved some step ahead. Any heart damage, either it be due to heart attack or either it be due to coronary bypass surgery or even putting a stent, there is some injury in the heart, and that takes some time to recover. And only survival of the patient is not important, but a good quality of life is also important for the survivors. So here, cardiac rehabilitation plays a very good role. And this is not only exercise, it's blend of medical management along with dietary advice and gradual guided exercise sort of thing. So what happens even after myocardial infarction for total recovery, patient heart takes usually 2 to 3 months. During those periods, proper dietary advice is important depending upon the cardiac function, remaining cardiac function of the patients.
Right.
Like if the ejection fraction is compromised and patient is having sign and symptom of heart failure, we should advise him to take less of fluids, low salt diet, and small frequent meal. Along with what we do, we do some modified stress test for checking the exercise capacity of the patients, and accordingly we plan exercise, gradual exercise, to lead a good quality of life even after gaining her or his functional activity. We should also take care of his professional life. Yeah.
All right. All right. Thank you so much indeed. We're completely out of time on this edition of Health and Wellness Save a Life, but we hope this has been a useful conversation. Thanks so much for watching.